Between 2 a.m. and 4 a.m., when your heart rate drops and your blood moves slowest, the position your body holds against the mattress is quietly shaping whether a clot forms in your carotid artery or doesn't. Research published in cardiovascular sleep journals indicates that adults over 60 who sleep in specific positions experience measurable drops in nitric oxide, the molecule that keeps arterial walls relaxed and blood flowing freely for up to 6 consecutive hours. And here is what no one has told you yet. The position most seniors consider the most comfortable is the one most associated with restricted cerebral blood flow while you sleep. The danger is not in your diet, your stress, or your waking hours. It is in the 8 hours you spend completely unconscious and completely unable to change a thing. In some studies, seniors sleeping in the wrong position showed measurable changes in blood viscosity and carotid compression patterns that parallel the physiological conditions preceding ischemic stroke. That question no doctor has ever asked you. What position is your body in right now, every night, while your heart has the least protection? Has an answer. And the answer changes tonight. My name is Dr. Daniel. For 23 years, I have specialized in the connection between sleep mechanics and stroke risk in cardiovascular patients over 60. In this video, I will walk you through 5 sleep position factors, research links to nighttime stroke, ranked by severity. The correction costs nothing and begins tonight. Sleeping 7 or 8 hours and waking without pain is not the same as sleeping without cardiovascular damage, and after 60, that distinction may be the most important one your doctor has never drawn for you. A rubber garden hose left outdoors overnight in cold weather does something predictable. The material stiffens under sustained positional pressure, the internal diameter narrows, and the flow distribution across the length of the hose shifts in ways that cannot be seen from the outside. By morning, before the tap is ever turned, the compromise is already done. Your arterial walls behave according to the same physics during sleep. They are elastic tissue under sustained positional load, in a body whose temperature drops, whose circulation slows, and whose regulatory systems shift into a reduced oversight mode that most people assume is protective. It is not always protective. After 60, the body's production of nitric oxide, the compound that signals arterial walls to stay wide, pliable, and resistant to clot formation, drops significantly during sleep, and in seniors, this drop is steeper and lasts longer than in younger adults, creating a window every single night when arterial narrowing and blood thickening occur simultaneously. That window opens every night while you sleep, whether you feel it or not. In more than 2 decades of connecting sleep mechanics to cardiovascular outcomes, the patients who concerned me most were never the ones who came in with obvious symptoms. They were the ones who came in feeling fine, right up until the morning they didn't. What determines the cardiovascular cost of those nightly hours is not just what you eat or how much you exercise. It is the position your body holds against the mattress for 6 to 8 hours, while every protective reflex you have is offline. The 5 factors I'm about to describe are ranked by cardiovascular impact. The one at the top is almost certainly not the one you are expecting. The position most cardiologists personally avoid sleeping in is not stomach sleeping. It is the right side, and for adults over 60 with any degree of left ventricular stiffness, right side sleeping is, in some studies, the position most consistently associated with reduced cardiac output during the hours of deepest sleep. When the body rests on its right side, the heart shifts within the pericardial sac, the fibrous membrane that surrounds it, and settles against the right lung. For a young heart with full elastic recoil, this shift is minor and transient. For an aging heart with reduced compliance, this positional compression is associated with measurable reductions in stroke volume, which is the amount of blood the heart ejects with each beat. Lower stroke volume during sleep means lower cerebral perfusion pressure, less blood reaching the brain, at the precise hours when clotting factors are naturally elevated and the vessel's ability to self-regulate is at its nightly low. Research published in the European Heart Journal and across the American Journal of Cardiology's Sleep Cardiovascular series has examined lateral decubitus position. medical language for side sleeping, and its relationship to cardiac output variability in older adults, with right side positioning consistently drawing the closer scrutiny. Worth noting carefully, research suggests this effect is more pronounced in seniors already managing hypertension or early-stage heart failure. If either of those applies to you, sleep position is a conversation worth having directly with your cardiologist because your individual risk profile shapes how significant this factor is for your specific heart. Right-side sleeping is only the first item on this list. The next one will stop anyone who has spent years believing they had already found the safest possible way to sleep. Flat back sleeping, the supine position, is the one most commonly recommended for spinal health, and for good reason. But for seniors with any degree of arterial stiffness or undiagnosed sleep apnea, research associates it in some studies with the highest rate of overnight blood pressure surges, concentrated specifically during REM sleep, when cardiovascular regulation is at its most vulnerable. The mechanism is gravity-driven, and it operates while you sleep without any awareness on your part. In the supine position, the tongue and the soft tissue at the back of the throat settle backward, partially narrowing the upper airway. Even in seniors who have never been diagnosed with sleep apnea, this microobstruction is enough to trigger repeated sympathetic nervous system activations, the body's emergency response cascade, the same system that fires when you are startled or threatened. Each activation spikes blood pressure and elevates heart rate. Each spike is a cardiovascular event. Multiplied across 6 to 8 hours of sleep, the cumulative strain on arterial walls is not theoretical. It is measurable, and research from the Sleep Journal and the American Academy of Sleep Medicine has documented positional obstructive events and overnight blood pressure variability in adults over 60 in direct relationship to supine sleeping posture. Something worth sitting with. If you snore regularly, wake in the night for reasons that aren't clear, or finish a full night's sleep feeling like you have not rested, research suggests positional airway obstruction may be contributing in ways that go far beyond inconvenience. And that is a conversation for a sleep specialist, not something to dismiss as a normal part of getting older. Which sleep position do you use most nights? And when you wake in the morning, before you have moved, before you have had coffee, have you ever noticed a headache sitting behind your eyes, a heaviness in your chest, or a heart rate that already feels elevated before your feet touch the floor? Leave that in the comments. You are not the only one who has felt it, and the reason may be directly connected to what your body was doing while you slept. For years, I overlooked what I am about to describe next. Most cardiologists did. What stomach sleeping does to the cardiovascular system at night is something the research community came to later than it should have. Stomach sleeping almost never comes up in stroke prevention cardiology, not because it is rare as a sleep habit, but because the specific mechanism connecting sustained neck rotation during stomach sleep to vertebral artery compression went largely unstudied until relatively recently, leaving millions of seniors completely unaware of what their nightly position was doing to the blood supply reaching the back of their brain. Nearly every stomach sleeper rotates their neck to one side to breathe. There is no alternative. And that rotation, held for 3, 4, 5 hours while you sleep, applies sustained mechanical pressure to the vertebral artery, one of only 2 arterial pathways supplying blood to the posterior brain. In younger adults with flexible, plaque-free arterial walls, this compression is partially offset by vascular elasticity. In seniors, where arterial walls are less compliant and atherosclerotic narrowing may already be present, research published in Stroke Journal and neurovascular sleep studies from major academic medical centers associates this sustained positional compression with reduced posterior cerebral perfusion, meaning less blood reaching the region of the brain responsible for balance, coordination, and vision. This is the answer to the question raised at the start of this video. This is what sleep position actually does to the cardiovascular system while you sleep. The correct position does not compress that artery. It leaves the vertebral pathway open for 8 uninterrupted hours. I want to tell you about a patient I will call Gerald. He was 71 years old when he came to see me, and he had been sleeping on his stomach for more than 40 years. His complaint was not chest pain or shortness of breath. It was dizziness. a specific sensation he described as the floor tilting for the first 4 or 5 minutes after he stood up every morning, reliably, every single day. He had been told it was blood pressure. He had been told it was age. Nobody had ever asked him how he slept. Imaging showed no infarct, but Doppler studies revealed reduced vertebral artery flow consistent with the pattern of sustained positional compression. Gerald changed his sleep position. 3 weeks later, the morning dizziness was gone. His cardiologist had managed his blood pressure medication for years without once asking the question that turned out to be answered by a pillow. There are people watching this right now who have had the same symptom for years and have never once connected it to what their neck was doing while they slept. If you experience morning dizziness, visual changes immediately upon waking, or balance disruptions that resolve within a few minutes of standing, please do not file those under normal aging. Research suggests those symptoms warrant a cardiovascular and sleep position evaluation, and the sooner that conversation happens, the better. What comes next is a statistic that I still find stops me. Most physicians have never been told it either. Stacking 2 or 3 pillows under the head is one of the most common sleep habits among seniors, often adopted after being told by a doctor to elevate the head for reflux, for breathing, for comfort. The intention is correct. The method, in many cases, is working against the very outcome it was meant to support. When pillows are stacked under the head rather than under the entire upper body, the cervical spine, the neck, is forced into flexion, creating what amounts to a partial chin-to-chest angle that is maintained for hours while you sleep. This angle compresses the internal jugular vein, one of the primary drainage channels that carries blood and metabolic waste away from the brain. Proper cerebral venous drainage, the overnight system that clears inflammatory byproducts and metabolic waste from brain tissue, depends on a relatively neutral cervical spine position. When that angle is compromised by excessive pillow stacking, the drainage is partially obstructed. Research connected to glymphatic system studies published in Science and the Journal of Neuroscience has associated impaired overnight brain waste clearance with elevated vascular inflammation markers and, in some longer-term studies, increased amyloid accumulation, the protein deposit associated with cognitive decline. The brain's internal cleaning system runs while you sleep. The wrong pillow configuration partially closes the drain. Here is the statistic I mentioned. Research indicates that in some studies, more than 70% of ischemic strokes in adults over 65 occur between midnight and 6 a.m. Not during physical exertion, not during emotional stress, not during any waking moment when someone might notice and act. During sleep. During the hours when no one is watching, the room is dark, and the body is entirely on its own. Sit with that number for a moment. If you have been advised to elevate your head for a specific medical reason, please discuss the method with your physician, because a wedge pillow that raises the entire upper torso from the mid-back does not create the same cervical compression as stacking pillows under the neck, and the cardiovascular difference between those two approaches is not minor. The fifth factor connects every item on this list, and of all 5, it is the one most directly within your control starting tonight. The least discussed sleep position risk is not a position at all. It is the habit of moving without pattern, shifting from left to right to back across the night without consistency, and the specific way that inconsistency disrupts the body's circadian cardiovascular regulation during the hours it depends on the most stability. The cardiovascular system does not simply slow down during sleep. It follows a precise circadian rhythm, a predictable biological schedule of heart rate reduction, blood pressure dipping, and parasympathetic dominance across defined sleep stages. Slow-wave sleep and REM sleep each carry distinct cardiovascular signatures, and the body needs to move through them in sequence to receive their full protective effect. Frequent positional changes interrupt that architecture. Each shift triggers a micro-arousal, a brief partial awakening, that resets sympathetic nervous system activation and disrupts the sleep stage transition. Each reset is a small cardiovascular event. In seniors with reduced cardiac reserve, meaning a heart that has less margin for repeated activation cycles, the cumulative effect of a fragmented sleep architecture is, in some studies published in the Journal of the American Heart Association, associated with elevated morning cortisol, higher baseline daytime blood pressure, and increased circulating inflammatory markers directly linked to arterial plaque instability. Worth raising carefully. If you shift positions frequently throughout the night and find it difficult to return to deep sleep afterward, that pattern may indicate an underlying sleep disorder that is worth evaluating with a specialist, not something to manage alone, and not something that is simply the price of getting older, because research suggests it is addressable. Every one of the 5 factors just described is serious. That is not an exaggeration made for effect. But here is what is equally true. The person watching this video right now is in a fundamentally different position from the person who was asleep, in every sense of that word, before pressing play. What comes next costs nothing. It begins tonight. That word, tonight, is doing real work right now, and it deserves to be taken seriously. The information you have just received about your own cardiovascular system is not information most people sleeping in the same city as you have access to. Most people will close their eyes tonight in whatever position they have always used and never once question what their heart is managing while they sleep. You are no longer in that category. And that changes what tonight can be. The first change is the most impactful. Research suggests that sleeping on the left side supports cardiac output by reducing positional compression on the heart's natural pumping axis, improves aortic circulation, and reduces the degree of airway narrowing associated with the overnight blood pressure surges described earlier. Left-side sleeping also naturally reduces the likelihood of the cervical rotation that compresses the vertebral artery during stomach sleeping. This is a single positional choice made once before closing your eyes. The second change reinforces the first. Placing a pillow between your knees when lying on the left side maintains proper pelvic and spinal alignment, significantly reduces the tendency to roll onto the right side during deep sleep when you have no awareness of movement, and stabilizes the cervical spine in a position that keeps the arterial pathways discussed tonight in their most favorable orientation while you sleep. The third change addresses the venous drainage problem directly, using your existing pillows to raise the upper body 15 to 20 degrees by elevating from the mid-back, not by stacking under the neck, has been shown to help manage overnight airway patency and support cerebral venous return without creating the cervical compression associated with pillow stacking. If you are managing a respiratory or cardiovascular condition, discuss the specific elevation angle with your physician to find what is appropriate for your situation. 8 hours of sleep is not neutral time. It never was. The difference is that now you can decide what those 8 hours are doing. What you have just learned belongs in a short summary before this video closes, because each of these 5 items carries enough weight that none of them should leave without being named one final time. Right-side sleeping shifts the heart against the right lung, reducing stroke volume and cerebral perfusion pressure during the hours when clotting risk is naturally highest. Flat-back sleeping allows gravity to narrow the airway repeatedly through the night, triggering sympathetic blood pressure surges that strain arterial walls across every sleep cycle. Stomach sleeping forces the neck into sustained rotation that compresses the vertebral artery for hours at a time, reducing blood flow to the posterior brain responsible for balance, vision, and coordination. Pillow stacking under the neck flexes the cervical spine in a way that partially occludes the internal jugular vein, impairing the brain's overnight waste clearance system. And inconsistent position switching throughout the night fragments the cardiovascular sleep architecture the body needs to complete its nightly repair cycle, leaving inflammatory markers elevated and blood pressure less regulated by morning. Tell me in the comments which sleep position you have used for most of your life, and what you are planning to change tonight. Not whether you found this useful. What your specific position has been, and what you are doing differently when you close your eyes tonight. Someone else in the comments will read your answer and recognize themselves in it. If there is someone in your life who shares a bed with you and has never thought about what their nightly position is doing to their heart, send this video to them before tonight. And if you know someone who lives alone, someone who has no one awake beside them after midnight, no one who would notice if something went wrong while they slept, send it to them especially. That quiet act of sending this video may carry more weight than you realize. Next week, I am covering the morning routine that research suggests protects the cardiovascular system in the first 90 seconds after waking, the window when blood pressure spikes most sharply, clotting factors reach their daily peak, and stroke risk is measurably higher than at any other point in the 24-hour cycle. Subscribe so that video reaches you the morning it goes live. And to answer the question, this video opened with whether a single night of correct sleep position actually changes anything. One night will not undo years of accumulated cardiovascular strain. That would not be an honest answer, and you deserve an honest one. But it changes the direction. Research suggests that consistent left-side sleeping over weeks and months may support measurable improvements in overnight blood pressure patterns, arterial flow dynamics, and the quality of sleep architecture your cardiovascular system depends on for repair. One night is where that begins. Tonight is that night. You now carry something specific about your own heart that most people will live their entire lives without knowing. I have spent 23 years in cardiology and sleep medicine believing that information given at the right moment to the right person genuinely alters outcomes, not in a general sense, but in the specific biological sense that a changed position tonight changes what your heart manages for the next 8 hours. I am Dr. Daniel. Take care of yourself tonight.